Number 6, the microbiome and cancer. The human gut harbors more than 100 trillion microbes, a number that exceeds the average number of human cells in the adult body by a factor of 10. These complex communities of bacteria, fungi, protozoa, and viruses play an important role in our daily lives, affecting our immune system, digestion, and metabolism. Many things can alter our gut microbiota, such as diet, genetic background, stress, exercise, and sleep. We now have compelling evidence that the gut microbiota affects cancer via a number of mechanisms, including the production of carcinogenic compounds, the altering of immune and epithelial responses, and by altering the very drugs used to treat many cancers. By understanding how the gut microbiota affects carcinogenesis and tumor responses to therapies, in years to come, researchers will develop various targeted interventions that incorporate the microbiota to prevent or lessen factors that lead to cancer or impact cancer therapies.
Who could have imagined that in the list of the 12 most impactful changes in oncology, we'd be talking about bugs? Here to help us understand why, we have Lynn, who's the director of the Host-Microbiome Center at Brigham and Women's Hospital and associate professor of pathology. And Lynn, what we want to ask you is, when it comes to cancer prevention or treatment, will food and beverages, natural substances play a role in the microbiome, or will we be dealing with drug-specific therapies? How are we going to use this to change cancer biology?
Yes, absolutely. Thanks, Monica. Let's talk about the 90% of you that is microbial. And when it comes to cancer development or cancer treatment, all options are currently on the table, whether it's dietary interventions, whether it's small molecules, whether it's bugs as drugs, that we actually administer microbial communities to either prevent or administer certain therapies. We've been leveraging integrated human-animal model avatars where we can go from the bedside to the bench to the bedside, where we can take actual human microbial communities and study in defined conditions in a mouse which human microbes are important. What are their metabolic activities? What are their mechanistic functions? And now, armed with that knowledge, we're better enabled to go back to the clinic and ask, how can we leverage this information for therapeutic care to prevent disease or render better diagnoses? So particularly in cancer, we know there's certain communities that can produce pro-carcinogenic compounds. That's one area we could target. We know that microbes are important in the activity and efficacy of many immunotherapeutics used in cancer care. We also know that microbes are also important in degrading or otherwise metabolizing many cancer drugs, altering their efficacy and potentially producing toxic metabolites that lead to side effects. Thus, by understanding what the actual mechanisms are, what the microbes are, manipulating them down to actual genes, we can come back with better therapeutics, again, whether it's microbes, prebiotics, probiotics, or small molecules. So as we approach the noontime hour, I ask you to contemplate your internal microbiota and how, going forward, we may actually leverage this in cancer care. Thank you.